questions.
Yeah, and there's and there's some other topics that are a little more that I didn't cover. Things like how do you know if your program is ready to be evaluated in terms of outcome evaluation? Because not every program is ready for that. Didn't talk about that. We didn't talk about the role of culture in evaluation. Of course, culture can be a component within an evaluation process, and we have to learn how to embrace that. But it can also be tricky. So there's some other things that we didn't talk about today that we could talk about subsequently. And if there's anything I mentioned in terms of articles or publications that people would like to have access to, we can certainly make that available. So go ahead, the floor is open.
We have a question from Dr. Philip Rumroll.
Okay, great.
And the question draws back to the second slide.
Okay.
In your PowerPoint.
All the way back here. I think it's this one or this one.
I believe it's that one.
Okay. The visual slide about the demands.
Exactly.
Gotcha.
Exactly. And this question is, it seems to me that COVID-19 has rendered your perimeter graphic schemata even more important than it was before the pandemic.
Right.
COVID exacted an unprecedented toll on our public health and economic resources, not to mention its unspeakable global impact on mental health. Are some tiers of the pyramid even more important now as we move, hopefully, into the post-COVID era?
So
Dr. Lewis, it's Phil Rumroll. How you doing?
Hey,
Dr. Bauer could say it a lot better than he could say it better than I could, so I just had him read the question. But thank you for being with us, and always a pleasure, my friend.
Thank you. Feelings mutual, Dr. Rumroll. Thank you, sir. So yes, obviously, with COVID, with the pandemic, with COVID-19 came more demands on our funding. Demands that we didn't expect, things that that we had to pay for that were not in the budget up to that point. So it certainly impacted the demands that way. And then, of course, we now have, obviously, I know one of Dr. Rumroll's areas of research is emerging populations, because, as we go forward, the concept of disability, and because the world is fairly complex and the interaction of all these complex factors going forward means that sometimes we have new disabilities that we become aware of. And so we have the phenomenon of COVID and COVID long hauler syndrome, which are both COVID itself as a disease and long hauler syndrome, which is a new set of health challenges that can be very disabling. And so, yeah, absolutely. So that's a new impairment that adds to our already complex mixture of impairments that people show up to healthcare providers seeking services for. So absolutely. And, it increases accountability. I mean, accountability in terms of customers. Customers expect us to also be able to, the system to be able to be effective in dealing with COVID and COVID-related functional impairments. So I think it impacts everything. The funding, it's a new impairment. It makes people have higher expectations on the system, which is a source of accountability. So it has given us more strain and more stress and more complexity than, as if we needed more, than we had prior to COVID. So absolutely.
If you have a question for Dr. Lewis, please put the question in the Q&A box at the bottom of the screen. If you hover over the bottom of your screen, a Q&A box will pop up. And
yeah, it looks like we have about 30 minutes, so we have some time for some good questions and good conversation.
We do. You can also certainly raise your hand as well.
Dr. Bauer, it's Phil. I've got another question, but I want to wait for others just so as not to monopolize. So if we get a lull, I had one about evaluation in particular, Dr. Lewis.
We do not have a question at the moment. So if you want to ask your evaluation question, Dr. Rumroll, please feel free.
All right, Dr. Lewis, this is my last one, I promise. And I'm just going to be quiet and listen.
Ask as many questions as you want, Dr. Rumroll. Yeah.
I'm glad you brought up the SIP model, and Dr. Stufflebean, of course, is a role model and hero to all of us. This model is just so good and encompassing, and it's really the the gold standard in broad-based program eval for sure.
Right.
I was thinking as you were talking that, and we're working on a couple of proposals right now, where the funding agency, this is true of NIH, it's true of NIDLR, they give us a structure for the logic model and use that, and we have to then kind of plug that in.
Right.
And sometimes we only have a couple pages on the eval or one chart or, that kind of thing, even though the SIP model would be more encompassing and would allow us to, articulate more details about the eval. And we end up doing some of those things regardless, but getting it into the proposal is sometimes you have to kind of make it fit, if if that makes any sense.
It does.
I'm wondering if you have any strategies for the 40 or so folks who work in our evaluation unit about how we might bring in elements of the more encompassing and elaborate SIP model into a circumscribed logic model structure. How do you sneak in the operationalization of Dr. Stufflebee's model, with limited text and space and 2 boxes to plug it into?
Yeah.
Any tricks of the trade?
I don't know if it's a trick, but a couple of suggestions that might work. Who knows if they'll work? I haven't tried this per se, but a couple of things that come to me. So if the funding source is mandating a logic model approach, which they often do, and sometimes they give you an actual template for how they will, because there are various ways you can do logic models, and so sometimes they give you a very specific template that you got to plug into, which is fine. But sort of what I said early on, what I would do is if you don't have the ability within your grant format, the proposal itself, to display the SIP model, and if you're particularly if you're developing something new, I might, in the narrative itself, put a paragraph description, a very concise and brief description of the SIP model, and say, here's the model that we're using to develop this, or here's the more comprehensive model that we're using to evaluate this, in addition to the logic model that you're prescribing us to use. And this, say how those two interface. So as I said early on, the downside of the logic model is that if you're developing something new, it's not as good in helping use data in the developmental process, whereas the SIP model is much better for that. So one thing I might say is, see your grant saying we're going to propose developing a new program of practice as part of this grant activity. I might say, and we're going to use the Stufflebeam's decision-oriented SIP model to help us use data to develop it in narrative. We're saying this in a narrative format. Say what the model is, say how you can use those 4 components: context, input, process, and product evaluation, answer those questions. And then once we've run through this, once we have a operational program and we've gone through one cycle of measuring outcomes in the product evaluation of the SIP model, then we're going to kick into the logic model and let that be an overarching, sustaining, program descriptive, evaluative model that we use going forward. And when necessary, we may refer back to the various types of evaluation in the SIP model or some other model. So I would try to talk about them in tandem and how they complement each other. But even if you don't have the ability to graphically display the other model or the SIP model along with the logic model, just put a little bit in the narrative that kind of speaks to how these two models will interface. That's what I would suggest.
That's a great idea. I love that.
I've not tried it, but I think you could do it. I've not tried it.
I'm wondering,
but I think it's doable.
Sorry, Alan. I just want to reflect on what you just said. What we might be able to do if we did it in exactly that way is we're drawing reviewers' attention to the fact that we're going to exceed the minimal requirements that they are providing, but we're still hitting all their metrics off of the logic model, but we're showing them that we're going to even go beyond that.
Right.
And I think when you meet all the criteria in their logic model, they kind of check the box. So you probably get, most of the points. But if there's any left hanging, you say we're going to do some things that are even more thorough and more encompassing, and you don't use up too much text to do that. You're actually giving yourself the best chance for full points on there. And they also then read the rest of your proposal with that in mind, that you've kind of gone over and above without it taking too much extra text. So I really love the efficiency of that. I hadn't thought of it in exactly that way, and I appreciate you I appreciate you articulating it that way, Alan. Thank you.
You're welcome, Dr. Rumble. And you probably could use maybe a third or half of a page for the narrative text and maybe do an in-page insertion, maybe a quick diagram to show the SIP as an in-page figure or diagram. And then, so it probably no more than a half page total with that in-page diagram, and the narrative would be all you'd have to add. And then you're right, and you make sure you get all the points, and they realize that your evaluative understanding is much more in depth than what they're asking for, and so that bodes well for the reviewers. Absolutely.
Dr. Lewis, just so you know, we may be bothering you on our next proposal.
Sure, absolutely.
Just fair warning.
You and I talked about that, I think. So yeah, absolutely. Would love to help in whatever way.
Thank you. I said I was going to be quiet, everybody. I'm going to now. Thank you very much.
Questions for Dr.
I love
Lewis?
the questions. I love the, so if Dr. Rumrell wants to ask all the questions, that's fine, but gotta have some questions.
Yeah, and Alan, I think as we wait for questions, I definitely have a question here. So as we're thinking about things, and I know that you are an expert on data-driven decision making. So as we're thinking about it, can you tell us about a time that you use this method to guide a decision that you made in your role?
All the time. One of the things I did when I first, almost 7 years ago now, I'm 2 months shy of 7, a month actually shy of 7 years, when I became the dean of my current school. Back then it was a college of health-related professions, and now it's a school of health professions. One of the things I did when I first got there was I did a training on logic modeling, just on logic modeling. And so a lot more detail than what I talked about today for all the academic chairs and the associate deans in our school, and asked them to begin using logic models routinely as part of their program accreditation and assessment processes in their respective programs. And, so, I did it in that way. I do a logic model. If you would, my kids are 31 and 24. If you would ask my kids, either one of them, what's a logic model, they can tell you, because I said, let's do a logic model on baking a cake. Let's do a logic model on washing the car. So I think the logic model has to become second nature. And I do them quickly, at least the first draft, very fast. And so I don't have I just did, as a matter of fact, I do have an example. I just did one recently. So at our campus in downstate, we have a Black and Latino male initiative that's designed to build pathways into our graduate and professional programs on our campus from some area undergraduate programs. And then once we get these students who identify themselves as Black and Latinos, Latinx, in our programs, then we try to make sure we do some guided mentoring and have some supportive programs for them. And so this is just taking shape. And we had a draft proposal that the person who runs the office that does this on our campus, who's in the College of Medicine, put together, what our objectives are, what our activities would be, and those kinds of things. And when I saw that in a meeting probably about a month ago, I said, oh, okay, this looks good. I said, do you mind? Because the one thing he didn't have in there were any outcomes or any impact. And I said, okay, are you all familiar with the logic model? And just so happens one of the, I have a chair of occupational therapy who's actually, he has a doctorate already, but he's getting his MPH at our School of Public Health. He was enrolled in a class on logic modeling when I said that. And he said, oh yeah, I'm just right, logic model. I'm in a class, we're talking about that. And another physician who was talking, a pediatric ER doc, said, yeah, I've heard of logic models too. So they agreed to let me take the raw material that he had written down as a basic concept for this program and to put it into a logic model format that just this week, I sent it back as draft number 1 of the logic model for this Black and Latino male initiative at our institution. We'll be meeting next week where I will explain what I did, tell more about the logic model in terms of what it is generally, and explain how I took the information from the concept paper essentially that he had written and put it into a logic model format, and will explain the strengths of doing that, because it will give us he had several pages, but I reduced it to 1 page. So it's at a glance, you can see our inputs, starting resources, our activities and processes we're going to engage in, the outputs, the yield, the dose, and who we're serving, and then the outcomes all at a glance in a somewhat visual manner that's intuitive on its face, because when you look at it, it sort of makes sense. And then I've got 3 levels of outcomes. I've got immediate outcomes, intermediate outcomes, and long-term outcomes in the outcome column, so that we can figure out how we want to deploy ourselves to not overpromise in terms of those ultimate outcomes right away, but at least identify those that are more downstream at some point, but have some early outcomes that we can really identify that we want to deal with immediately. So yeah, that's a more recent example. And I don't know if I can pull it up. I'm trying to think where it is. I may be able to pull it up if people want to see it. So depending on what other questions we have time, I'll be happy to try to find it and pull it up.
Yeah, thank you. Thank you for sharing that more recent example there as we're
Yeah, and once you've done enough logic modeling, I mean, literally, person who does a lot of logic modeling can put the first draft together in about 15 minutes, literally, because it doesn't take that long to just put things in those categories. And now that's a very beginning rough draft. And then ultimately has to have buy-in. So what I'm doing now, that's what I did. So when we go to our meeting next week, well, there are about 8 of us that work on this committee that are developing this initiative. So then I'll explain what I've done, and then we'll get some comments and some adjustments and some revisions, and then ultimately we'll come out with a model that I hope we can all embrace and have buy-in for. But at least there were 2 people in the group other than me who had knowledge of what a logic model was. So that's very important, because sometimes you got to start from ground zero and say, okay, here's what we're talking about. What's the logic model? Here's an example, and which is fine, because that's where it starts. Everybody's not automatically exposed to this concept. So if you've written grants in human services, you usually are exposed to it, because a lot of the grants that we apply for require something like a logic model, if not an actual logic model, for part of the evaluation component.
Thank you.
You're welcome. See, and that goes back, I was an evaluator from as part of my career as well. And so me being opportunistic, when I first came into rehab in an academic position, what I was looking for were the things I already knew about in terms of content areas that I wasn't seeing anybody write about in the disability and rehab world. And so logic modeling was one of those things. And so I'm always thinking opportunistically that way. Oh, nobody's writing about this? It's clearly something that can apply to disability and rehab services. So why not? Why shouldn't I do it? So that's how I kind of got into that.
And I can definitely tell it's something that is embedded in everything that you do, like you said, on a daily basis.
Right. Literally, if you ask my kids what's a logic model, they can tell you. Because they will say, oh my God, not that again.
And then I have another question, but I want to let Walt go ahead if you have any questions.
We do not appear to have any other questions right now. So Dr. Wright, if you'd like to go ahead and ask your question, that'd be great.
Okay, and I just have a question, because we talked about how disability is a dimension of culture, and we're focusing on that one. And I think that having a culture of research here in the Human Development Institute and focusing on that one, how does data-driven decision-making, how does that become part of the culture? Because you talked about how it's invested and it's a part of your daily tasks and what you do and how you go about solving problems. And you talked about how important it is in the outcomes and how beneficial it can be, but how can that be a part of the culture? How do you work with that?
So remember this slide, Dr. Nicholas? This is the building the culture. So the first bullet refers to this picture, from that picture. So that's the first step. Make sure everybody understands this picture or a picture like this, which is the macro context about the stressors we're dealing with in healthcare and why we have to know what works and what doesn't work. And then I suggest that you do what I did when I first became dean, was to promote logic modeling organization-wide. Get everybody, do a basic training on logic modeling, just logic modeling, which can be an hour training in and of itself, easily, depending on how many examples you have. And then issue a charge that everybody in this organization needs to develop a logic model that relates to their scope of work. And then once everybody has one, the people who work in the same unit can review their models together and review them with their upline supervisor or manager. And then the manager needs to put together a model for the whole unit. So the model at the unit level will be more macro than the individual model that each person has. And then all the unit models need to feed into a division. If you have divisions, I'm not sure how your Human Development Institute is structured organizationally. But let's say you had divisions, but so then you have a division model that all of the unit models feed into, and then you have an overarching model for the whole Human Development Institute that's really, truly a macro logic model. Doesn't have much detail, but speaks to the very generic kinds of inputs, activities, outputs, and outcomes that your Human Development Institute is promoting. I think if you can get people in your organization to all do a logic model and understand the value of a logic model, and once they have it, how it depicts exactly how their program works on a one page at a glance perspective, and how you back up to the logic model, looking at the outcomes and then the yield and then the processes when you don't see the outcomes you're looking for, that will go a long way to promoting buy-in to doing data-driven decision-making. And the other thing is, as you go forward with doing data-driven decision-making, as you hire an evaluator or maybe have somebody in-house who's part of their job becomes to be the evaluator because they have those skills, you want to make sure that you ensure that you're not doing overkill with your evaluation and data-driven decision-making. You got to keep it lean and mean. You don't want everybody collecting 200 data elements every month to evaluate their respective programs. Too much. Got to find a middle ground so that it's doable, because your mission is not to do research. Your mission is, as I would assume, is as a different type of organization other than a research. If you're a research organization, you can do as much of that if you want. But if that's not your core mission, then obviously you have some other things to do other than collect data and take measurements. But you got to do some of it. The question is how much works for you. It's just enough. And then as you develop new programs, make sure you use a data-driven decision-making process like the SIP model to develop those new programs, because that begins to illustrate to people how we can be more data-driven in developing these new strategies, interventions, practices, and programs. And in every chance you have, let faculty see, yes, doing data does require some additional work, but the payoff is well worth the investment, because we cannot afford to be in a situation where we don't know what's working and what's not working among our core services. You have to have that knowledge so you can deploy yourselves in a way that maximizes your output and do the things that work more than the things that don't work.
And I think that's what a lot of people want to have when we're thinking about it, is making sure that the payoff is worth the investment that's there, right, especially in the scenario of having limited resources.
Right.
And then I also think that when you were discussing it a little bit and you were talking about how to do some training over promoting logic modeling, I like how you talked about having it specific, because we can think about hypothetical situations, but when we think about hypothetical situations, it's challenging to get people attached to those and to be committed to it. But when we can make it more specific to their actual project, I'm sure that they're going to have better outcomes with it.
Right. Yeah. There's a concept in training called just in time. And the more you can make that relevant to things that they have to do anyway, and the more that the timing of having to have that learning coincides with when they have to use the learning, the better off, and the more people buy into it. So you're right. If it can be more meaningful because it really relates to what's something they have to do anyway, and the timing all coincides in an optimal manner, then yeah, people buy into it for sure. And then they see the value of it. But make no mistake about it, data-driven decision-making is adding work to your plate. But it's work that has to be viewed as being valuable because it helps you deploy yourselves in a way where you're no longer doing the things that are not working and doing more of the things that are working. But you got to have some way of knowing what works and what doesn't work to deploy yourself that way. So it's kind of, some things are a necessary evil. You got to do a little more to gain a little more on the output side. But if you do it properly, it's well worth the investment. Don't overdo it. Don't become overly zealous in terms of how you evaluate everything all the time. Too much. Pick and choose where you're going to start your evaluations. And again, outcome evaluation is not something that every program or practice needs to engage in early on, because outcome evaluation really requires a certain level of stability and maturity in the program or practice that you're evaluating. For example, if your organization has just gone through a reorganization, or if you're just going through a merger or acquisition of some sort, outcome evaluation is the last thing you want to do. People can't even begin to think about doing that because things are so topsy-turvy and unstable. If your program's not at least a year old don't even think about doing an outcome evaluation because you probably haven't done enough implementation or formative evaluation to be clear that what you're getting in terms of the service recipient population, the intervention is being delivered with integrity with what your intentions are, and the dose is high enough. You got to have enough of that well ahead of the outcome piece. So the outcome evaluation doesn't come immediately with all new programs. You kind of delay that because it requires a certain amount of maturity and stability. And you got to have some resources in your organization to do that. You got to have somebody who understands data, somebody who can do the analysis. You got to have a data system that allows you to capture the data, efficiently, and all those things. So, and people have to buy into it. Have to have some minimal level of buy-in, and not everybody will. But once they see the value, then the buy-in begins to skyrocket.
We have a question from Kim Sabali, and the question is, can you talk a little bit more about involving people with disabilities in evaluating disability projects and programs, as in participatory action research?
Yeah, pair participant. Yeah, absolutely. So evaluation is just research. It's just applied research. So, and I'm glad that question came up. So I didn't hit that point hard. Sort of implied in terms of hiring these researchers who are evaluators to kind of get carried away. But yes, participatory action research is really a great model, and it's being endorsed much more these days going forward, because the bottom line is the participants in the research process or the evaluation process, evaluation is just applied research, should be benefactors of the research. And there's no reason to be exclusionary in any sense in terms of who is allowed to be the PI on the research or be the PI of the evaluation study. And people with disabilities should and must, I would say, be involved at the ground level of conceptualizing the evaluations. Just like we have to have a consumer voice in how the service is developed and delivered, we've got to have a consumer voice in evaluating the success and the overall effectiveness or efficacy of the program itself or practice. So it has to happen. And now there are certain funding streams that really speak to this. If you're familiar at all with the PCORI, Patient-Centered Outcomes Research Initiative, which is a source of federal funding that came into being with the Affordable Care Act, and the mandate for all the studies that are funded through PCORI is that there be a genuine, authentic partnership in the conceptualizing of all the research and the conduct of the research and the analysis and the dissemination of the research every step along the way with not only researchers, but the people who are the benefactors of the research. So if your research study is looking at persons who have diabetes, then you need persons with diabetes on the ground floor as you begin to think about even doing this project, they got to be in the conversation as an equal partner, a level playing field. I once submitted a PCORI proposal years ago that was looking at the role of hip hop as an evaluative intervention for increasing the awareness of young Black and Latino males in their understanding of disability. And so in doing that, my co-PIs were a group called Four Wheel City out of Queens, New York. Two fellas who themselves were in wheelchairs, who themselves were Black and Latino, who were going to be delivering the intervention. They were the hip hop artists, and they did positive hip hop about disability awareness and violence prevention. And so the goal there was I partnered with them to put the proposal together from the very beginning, and they were going to actually be the architects of the intervention. Let me let my dog out of the room here. And so the idea was they were going to be architects of the intervention. And when we got to doing the data analysis, they were going to be equally involved with me in any research publications and any dissemination of the results. They were involved in every phase. That grant didn't get funded. I often think about resubmitting it. But that's an example of a participant action research project that really involves the benefactors of the research right from the ground zero through every aspect of conceptualizing the grant proposal and the research from inception all the way to, if it's funded, you have data that you then want to disseminate in journal articles, conference presentations, books, whatever it is. So yeah, it's very important. And it's a really growing field in terms of making sure that the benefactors of the research or the evaluation have equal footing and status in the process of producing the research from the beginning all the way to the end.
We have a question from Cameron, and the question is, in your experience as an evaluator, did you ever make use of an empowerment evaluation framework? It's a line of research I'm interested in, and I'm interested to hear your perspective on its utilization when evaluating programs.
Yeah, it's a valuable framework. I've not done so much of it, but it, obviously in in any kind of research where you're looking at either underserved, underrepresented communities, whether they be persons with disabilities or persons who are underserved, underrepresented based on economic resources or whatever in terms of opportunity, you want to make sure that you have an empowerment model allows you to address that with those communities. And again, it's sort of like participatory action research in terms of making sure you engage in the research or evaluation process the communities that are underrepresented and need to be more represented and validated through the research itself. I've not done as much of that other than the example that's talked about with the hip hop study, but it is a very valid and growing type of research and evaluation that you see more and more these days. And I'm trying to think if I think I may have included a little bit about that in the book chapter I did in 2014. But yes, that's a growing area, and it's really designed to give people a greater voice through the research itself, empowerment research. It really allows underrepresented and populations that have formerly not been heard from much to be much more empowered, much more forthcoming, and much more self-determining in terms of articulating the things that are best for them through the research process.
We also have a comment from Andrew, and the comment is, in my world working with an employment services organization in Virginia, I realized that the CARF process promotes evaluating and viewing our program through a logic model approach and ensuring that there is consistency across all elements of the program. In other words, their focus on efficiency, effectiveness, and self-determination push us to look at and integrate many of these elements of the data-driven decision-making model.
Right. CARF is the Commission on the Accreditation of Rehab Facilities. So it's an accrediting body, sort of like Joint Commission, but more for the rehab facility. Joint Commission is for hospitals and CARF is for rehab facilities. And so absolutely. The logic model is very important in that, but I would say even more than a logic model, one of the things we didn't talk about today is how do you build an outcome measurement management system? And that's a more comprehensive system within an organization that goes far beyond the logic model. And what it does is it allows you to measure all aspects of your organization's operations, not just the outcomes that come from or that should come from the core services, but it allows you to measure the effectiveness of all your internal operations. If you have a strategic planning operation, if you have a fiscal and budgeting operation, if you have a community engagement operation, it allows you to have evaluation metrics to look at all of your operations. And so it's much more of a comprehensive system. And I call it an OMMS, Outcome Measurement Management System, which is a total evaluation system for an entire organization that has both individual level outcomes as also outcomes related to operational processes, to key processes that make your organization run. So we're doing that right now in my school, putting together an outcome measurement management system. And so we have an evaluation assessment initiative work group. I put together a basic sort of a comprehensive framework of all the outcomes I could think about in associated measures that we could potentially measure as an organization, everything from admissions to graduation to deceleration for students, for kicking students out, for all of our dean's office operations, all the operations that a program has in terms of what it takes to keep the railroad running on a daily basis, planning, strategic planning, community engagement, all those things, accreditation. We have a comprehensive set of outcome measures that we can't develop them all at once, but we're going to put together a plan that says, here's how we're going to sequence putting this system together. It'll probably take us 5 years to have a completely operational outcome measurement management system, but we're starting that process to prioritize the things we want to look at first and foremost, and the things that will be, downstream, so that at some point we'll have, in addition to logic models, we'll have measurement protocols for every aspect of an organization's operations. And that's really the gold standard. You can kind of get that. It requires a lot in terms of data systems. You got to have you got to have a way, particularly when you measure patient or client outcomes, you got to have a unique identifier that everybody agrees to. You got to have a core services taxonomy that speaks to how you define all the things you're doing if you're doing different types of services. So it requires a lot of infrastructure and capacity that you have to build to put that together. But it is sort of the gold standard if you can kind of do it. But short of that, you can really just go with a logic modeling and begin to build a culture of data and understanding and appreciating data within your organization. And the logic model or the stuff will being model will take you a long way in terms of those two goals.
That is all the questions we have for today.
Okay. Oh, we're at 3. Okay.
We are.
Yeah. Okay.
We thank you so much for your time, Dr. Lewis. As advertised, this has been great. It's been an honor and a privilege for you to join us today. Thank you for taking time.
Same for me, and I hope it has been as good as you just said. So the evaluations will tell, and we're talking data, so it got to evaluate, right? I did
yes, we do.
Evaluate, so we'll hear more up close and personal what the feedback is once people do their evaluations. And and I'm a big fan of evaluation is not a gotcha. I think I said this earlier, or audit process. It doesn't matter how good or bad you are based on the data right now. The point is that tomorrow you're a little bit better. So you start where you start, right? The next day you're better, the day after that a little bit better. So over time you get better. As long as you keep moving in the right direction towards continuous quality improvement, there's no shame in starting at a low point.
Thank you, Dr. Lewis. Andrew says thank you as well. And I want to thank you for taking time out of your day to share your experiences and expertise with us. Thank you for an informative presentation. Be well and stay safe, everyone.
Absolutely.
Thank you, Alan.
Thank you.